Welcome to the Mindset Mentor. I'm Tania Kolar, helping you live your best life. You know, our mindset is crucial to living our best life and how we feel. And so many people have been struggling with mental health, the challenges, the daily stressors, anxiety, depression. All these things have seemed to escalate of late. And today's show, we're really going to help to, keep your mindset positive and give you some options when it comes to taking care of your mental health because it's so, so important. So on today's show, I have two special guests. They are experts in their field. Sara Dimerman, you may remember Sara. She had a show actually called Help Me Sara right here on Saga 960. And she has been up to so many great things. She has created a service called ReferToMe. So she's the founder of ReferToMe, which is a really great way to get you connected to the professionals and the resources that you need to foster wonderful mental health. So we're going to dive into that. She's also a psychologist. She's an author of multiple books, self-help books, my favorite category. So much amazing information there. She's also a podcast host. And also joining us today is Dr. Jordan Vollrath. He's a family physician. He's a digital health entrepreneur and a specialist working, of course, in mental health. So you're going to get amazing advice today and just the tools and sometimes inspiring thought and giving you that option of, knowing what's available, I think makes all the difference. So make sure you stay tuned. Dr. Vollrath is also Chief Medical Officer at Cherry Health, Canada's medical network. So we'll learn more about that. But how about we just jump into the conversation and say hello and welcome Dr. Vollrath and Sara Dimerman. Great to have you both on the show today.
Thanks.
Yeah, thanks for having us.
Yep.
Awesome. So, I'd love to just start with, a broad overview of your perspective on what you're seeing in today's society in terms of the need for mental health and the services that have been either available or not available to people. So, Sara, what can you say to that to start as a broad perspective?
So just wanted to also mention that although ReferToMe is heavily focused on mental health and the majority of health professionals on that directory or in that directory are psychologists, psychotherapists, social workers, art therapists, etc., we are incorporating not exclusively mental health professionals, but also other health professionals such as speech and language pathologists, occupational therapists, physiotherapists, dietitians, because I believe strongly in people working together in being able to provide what we call like a circle of care for our clients. And that's also why, I approached Cherry Health about working with us, because I felt that working with medical doctors, the medical doctors are the gateway to other specialists and often the first people that patients speak to about their mental health or physical health issues. And so for medical doctors to be able to look at the directory, ReferToMe, and be able to find somebody that is geographically maybe close to the client or the patient, or speaks the same language, or is dealing specifically with a certain area of mental health, such as an eating disorder, for example, is so vital. And the reason that I created that directory was so that we could all work collaboratively. And we could be able to refer to one another and also be able to talk to one another about different things that are going on. And the reason that I came up with the idea is because, as you mentioned, I've been a psychologist for over 30 years. And now that I've been in this field for a long time, my primary contacts or my colleagues are in the same position as me. Most of us have full practices after so many years. We're not taking on, or we're seldom taking on new clients. Some people in my age, lifestyle and time of life have retired from their practices. And I find that I needed to expand my network of referrals. And I also realized that medical doctors also needed to expand their list because, and I'm sure Dr. Vollrath could talk more about this, but often people will refer to the same old people just because they have those names in their so-called Rolodex. But they don't really know that those people are not taking on new people who have retired. So I wanted to make sure that we had a really up-to-date directory that people could just go to, type in a certain number of, just information into the search field, press select, and just, anyone that's in the directory that matches that search will come up.
That's awesome. I've heard that actually quite a bit where, a doctor perhaps is not taking on new patients, and then people are left to struggle. And actually, personally, my family physician of, decades had kind of gave up her practice, semi-retirement, so to speak. But she actually gave me a contact, but I also had other family members who were also, with her, who were not able to get, a doctor for quite a while. And I've heard
So,
this happen for other people.
well,
Would
that's
this
a
be
little bit
helpful?
different. That's a
Okay.
little bit different than the service that we provide, because we
Okay.
unfortunately are not finding doctors to refer to.
Yep.
So doctors will refer to professionals in the directory, but we don't have contact with other people that may be able to help them. But
Got
perhaps,
it.
Jordan, maybe you might have your finger on the pulse in terms of, I don't know, do you know doctors that might be available for people that are searching? Because that is a huge issue in
Yeah.
society right now.
Well, kind of unpacking that a little bit, there's two big things there, right? Like just the absolute paucity of physicians in general, right? Regardless of if it's a mental health or just your other well-being, right? And then
Mm-hmm.
two, at the same time, the actual mental health side of things. And that's one of the biggest underserved, underfunded parts of our healthcare system. And it's kind of crazy. Like I myself, my clinical practice is all focused purely on mental health, specifically as it relates to obesity and weight loss at the clinic there. And so my practice, there was a giant wait list to get in to see us, and we can only have so many visits with patients. But
Mm-hmm.
that mental health counseling is covered by the government of Alberta here. But then as soon as somebody gets referred over to a psychologist or a counselor, they don't have a billing code and a setup with the provincial government for that. So now suddenly it's unfunded. So you do find some pockets of physicians offering mental health counseling. I know here in Alberta, there's Owl Pod. My colleague Yashan Sharma actually just branched out to set up his whole own mental health clinic focused around addictions.
Mm-hmm.
And so you do find some resources here that are going to be covered by the government, but it's a huge blind spot just in general.
I agree.
Yeah. And so what about, you spoke specifically, Dr. Vollrath, about specializing in weight loss and obesity, which obviously ties into our mental health and, how we feel about ourselves, physically and mentally, right? But it seems to be that so many people, through COVID have increased their weight, through whatever reasons, maybe because we spent more time home and we were bored and had nowhere to go. And then it's like, what do I do, right? And so people, were even baking more was a thing. I heard so many people started to learn how to bake. And so, but therefore, if we're doing that, we need to eat and ingest those foods, right? So is that something that you're seeing now that has had a detriment, to lifestyle and everyday living that's on the increase?
Oh, absolutely. I mean, the link between just like weight management and mental health is huge, right? And so kind of the topic you're scratching on there is just sort of the concept of emotional eating in general. And so certainly boredom counts as one of those main triggers, but just in my practice, we see the full spectrum. People are rewarding themselves because something went well and then leaning into
Yeah.
food, or they had a bad day and food is now their coping mechanism, or they're lonely, or you name it, right? And so
Mm-hmm.
food winds up being that crutch for a lot of different people. And so it turns into a spiral, right? Because then that affects your image and your mindset, and that leads to more comfort food and so on and so forth.
Yeah. And I think, that becomes very dangerous where, it could lead to hopelessness when you feel like you're giving up, because it's like, all right, when you start to do a few things that are not ideal for you, maybe overindulging in, food or drink or whatever that addiction might be, we overindulge a little bit, let's say. And then when we continue to do that, we start to see some of the negative impact. And then it could be in the terms of, gaining X amount of weight. And then we just feel like, oh, we can never lose lose it. And I think that leads to that hopelessness, which leads to a lot of the depression, which leads to, a lot of other issues that we are experiencing on the mental health front. So do you have advice? Maybe both of you can share your experiences. If you have some advice for somebody who is struggling with addiction, in terms of how they can first maybe not even get to that point, because I think it's a lot easier sometimes to handle things before they get, extremely big and maybe these big addictions. So how can we sort of maybe be preventative in that case?
I
From
mean,
my,
oh, sorry, go ahead.
go ahead. I was going to
No,
say,
no, go for it.
from my experience working in the mental health field, I know that addiction or the propensity to be addicted is often genetic. Sometimes it's what you've seen in your family, but often there's a genetic component towards becoming addicted to something. And so, I would say that people who are self-aware or have been in counseling or looked at themselves, they might think about, I don't want to engage in the same kind of behaviors as my parent might have. So what can I do differently? Because the modeling might have been one, that you may, even if you see a parent over drinking, using alcohol as a too much, you might think, I never want to be like that. But sometimes you become that way even without intending to be. So being able to look at your own behavior and say, at the end of a long day, do you say something like, oh, I really need a drink, or that might be like a telltale sign or a red flag that if you're starting to say those kinds of things and your father or your mother had an alcohol addiction, what else can you do? So I think talking to somebody about it and nipping it in the bud in some way would be very helpful.
Excellent.
Yeah, that's what, Jordan, you were going to say.
Well, I was just thinking, I mean, addiction kind of covers a lot of different things that relate back to that mental health side of things. But step one is, just every once in a while, kind of stop and do an inventory and kind of try and take a step back and do an objective look at those habits, right? And certainly addiction, as it relates to my clinical practice, plays out a lot of different ways. We've got the people that are on the cannabis use disorder spectrum. And it's really difficult to lose weight if you just have the munchies all the time and you're in that kind of amotivational state where getting up and doing things and these other facets of your life and taking care of your general daily living activities starts to fall off to the wayside. Or as it relates to alcohol use disorder, now you're suddenly disinhibited. Now your goals and your ambitions in these other side of things start to fall to the wayside, let alone just the calories and the nutritional detriments just from consuming it all the way to the people that are just chocoholics, right? The chocolate and releases a ton of dopamine directly into your brain. And so we see a lot of that directly as well. And, just kind of like looking under the rug every once in a while and just having those honest questions with yourself of like, do I see any issue with my current habits? Like, should I take a closer look at this? Is there consequences to my life of what I'm doing that maybe I haven't been paying attention before? And a lot of it relates to, just the stigma around addiction and mental health, right? Like we've seen kind of a generational shift in this in terms of, people a lot more willing to just like have these conversations, be open with themselves, their friends, their doctor. And so that's been hugely positive just for society in general. And that's, still taking place. Only recently has that started to change.
Yeah, and what a beautiful shift, because it's so necessary, having these conversations, because then those conversations lead to the ability to take that inventory, and also to check in with family and friends as well, because we can be, a little more observant, let's say, to those behaviors, because we can be blinded in our own circumstances, and you were talking about, oh, Sarah, you had mentioned if someone says, oh, I really need a drink, right? Dr. Vollrath, you were talking about the chocolate, reaching for those foods. And I'm thinking I'm totally guilty of that. I mean, I've had those moments where I've absolutely overindulged, and it's that need sometimes of just to de-stress. But I have taken that inventory, as you say, and I've recognized those patterns, and, I'm proactive on, eliminating those patterns. But I think that first key piece is the awareness, delving a little deeper. And, Sarah, you had mentioned that, let's say, for example, that somebody, does have, an alcohol addiction or whatever that addiction may be. And you were saying that, it could come from that family pattern. So I look at it as though, I mean, my parents were not alcoholics. I'm not an alcoholic by any stretch, but I know I have a tendency sometimes to overindulge in something, whether it's chocolate or wine at a particular time or coffee. So I've recognized that there can be a pattern that I'm mimicking that's not directly one thing, but manifests in another way. Does that make sense?
Well, yeah, I mean, you look at how subconsciously and consciously you look at how the people around you manage problems, right? So, did your parent say, "I can't cope, I'm going to sleep, I'm going to have a nap"? That teaches a child or somebody growing up that the way that I cope with problems is I shut down and I go to sleep. Maybe that's positive because when the person wakes up, maybe they can handle the problems better.
Mm-hmm.
But sometimes the problem gets swept under the rug and never dealt with. And so you learn things by what you see around you. And so I think it is important. And to your point about, maybe sometimes overindulging, I think it's okay to sometimes overindulge so long as you have people around you that can keep you safe.
Mm-hmm.
I think it's also, I think, really important to look at, are you noticing changes in your own behavior? So I work with clients, for example, who might start using cannabis like socially and really enjoy the experience. Or maybe they're going through a really rough time in their lives and they find that it really numbs them or they don't think as negatively. And then they start to see, well, you know what? I'm just going to use it before I go to sleep every night. And then they start to notice that now it's not just before I go to sleep, but I'm using it like mid-afternoon just to get it because I think more clearly when I've had some cannabis or I've, had an edible or whatever. And so sometimes a client will even share that with me, but hasn't made the connection that their behavior is changing. And I'll say something like, so what I hear is that you used to use cannabis just before you went to sleep, and now you're using it daily, sometimes 2 or 3 times a day. Let's look at what's going on here. Like, why are you using this? So I think sometimes it takes, as you mentioned, somebody from the outside. Now, people are much more inclined to listen to their therapist or to their doctor and not always so inclined to listen to their families because they feel like they're being judged.
Well,
right?
the back goes up, doesn't it? Right, our
Exactly.
defenses, and we're already
Absolutely.
Preparing like how we're going to get out of this, right?
That's
It's
right.
like we
That's
feel
right.
like, oh no, right? So we're going to take a break in a moment, but Dr. Vollrath, I just want to give you an opportunity to add on to what Sarah just spoke about.
Yeah, I mean, it's a fine line between moderation and escapism, right? And certainly all of these things can go too far down that path, but it definitely is important to ask yourself, like, why am I doing this? And it could take any form, right? Gambling, sex, drugs, video games, alcohol, all these different things are potential channels for that. And like, am I self-medicating, right? Like, am I
Exactly.
treating some underlying thing, in a non-productive, kind of counterproductive fashion? And just like, really, you got to take a step back and evaluate that every once in a while. And if friends or family are starting to get concerned, that's definitely a red flag for you yourself to be like, okay, maybe I shouldn't just be on the defensive. Maybe I should consider perhaps my use of whatever one of these items is starting to get out, be an outlier on that spectrum.
Yeah, excellent advice. Absolutely. So we're going to continue this incredible conversation with my special guest today, Sara Dimerman and Dr. Jordan Vollrath. We're helping to, give you some options and some tools and have access to professionals who can help you on your journey with mental health. It's so important to living our best lives is to feeling optimal. And we're going to continue with this conversation here, helping you to live your best life. You're listening to the Mindset Mentor on Saga 960. We'll be back. Welcome back to the Mindset Mentor. You're listening to Saga 960. Today, we are helping with your mental health because, of course, your mental health really is so key and vital to feeling good. I think the worst thing is when we feel like, you get up in the morning and you just don't want to start your day, or you have a family member or a loved one who is experiencing that. So, it's really good to get some advice and just to see what our options are and maybe some access to professionals professionals and the professionals that, we can refer someone and a loved one to, or even ourselves, right? It's always important to take care of yourself, because remember, right, when you give your best self, that's a gift to everybody. It's a win-win. So my special guests today are Sara Dimerman. She is a psychologist for over 30 years, by the way. She's an author of 5 self-help books, and we can talk about those a little bit later. She's also the founder of Refer to Me, which is a great resource to get the information and access to experts in the field of mental health and more. And then our other special guest joining us today is Dr. Jordan Vollrath. Jordan is a family physician and a digital health entrepreneur. We'll talk about what exactly that means. He's also a specialist working in mental health, which again is, so invaluable these days. He's also the chief medical officer at Cherry Health, which is Canada's medical network. So I want to thank you both, Sara and Jordan, for being with us here today, because I think that mental health is now at the forefront, and it's so important to have these conversations. People, didn't want to talk about it, decades ago. People suffered, because of that, and suppression, of course, leads to dis-ease in the body, and all kinds of mental health destructive patterns, can come from that. So it's really important to have these conversations. And I would love to talk about some of the work that you do, Dr. Vollrath, and what digital health means. How can we get access to more mental health? And let's just dive in a little deeper.
Yeah, absolutely. So, a big focus of what we do is founded in that mental health aspect, right? So, of course, there's the big push on front of just like the patient-facing side of mental health, but also in terms of our practitioners, our physicians, our psychologists, our dentists, right? You name it. Like everyone out there is dealing their own things and fighting their own battles. And so one of the biggest problems right now is just burnout and depression in terms of the medical space. And so that's really one of the biggest impetuses and the reasons why we started building this medical network for Canada. We started out facilitating locums. That was like the entire value right there. And so locum is just Latin for substitute doctor, basically. And so in Canada here, there's no infrastructure to really like facilitate this across the country. You know how a school board has a central call room to help find substitute teachers? In healthcare, it's just a free-for-all. Like, good luck if you get sick, if you have a surgery, if it's just your anniversary or you have to go on vacation. And so there's that sense of duty to one's patients. You can't just up and leave or close down the doors because people's health starts to deteriorate, right? And so there's just this shortage of physicians across the country, let alone all the other healthcare practitioners, but specifically I deal with mostly physicians right now. And so you just could not find this temporary coverage. And so you overwork, you burn out, your capacity starts to decrease. We're seeing like a large exodus. People are retiring early. They're tapering back their clinical practice, their hours, doing things that are more non-clinical, and sort of this fire that's fueling itself in terms of just amount of practitioners out there. And so that was kind of the entire idea behind building this medical network, was just start connecting doctors with this temporary coverage. And it's since blown up to include the physician jobs and careers of all sorts. And very soon here, we're opening the network up to other medical professionals as well. All the allied health, just they deal with the same problems, right? Like, that's healthcare in Canada. There's just these blind spots. All the different practitioners are their own small businesses. And so there's not as much of this central coordination as, for example, in the teaching analogy. But that really is the big basis just around this.
Yeah, I love that. It makes perfect sense, right? Because it's just, having the tools and knowing where to go, right? To find the right people that can help you. I mean, that's essential. And everybody experiences, some form of stress, and it's really important for everyone to have, the ability to do something about it, right? And not to feel like they're alone. Because I think that's one of the big problems. And I think that's some of the crises that happened through COVID, is that big feeling of I am alone, and we were so disconnected, and I think people really struggle with that. So Sara, let's talk a little bit about how Refer to Me also can aid and assist with that, and add on to what Jordan had just spoke about.
Yeah. Well, one of the things I wanted to mention, and as Jordan mentioned, his Cherry Health is Canada-wide, and that's part of why I approached them about working with us, because we're Canada-wide as well. And I think that's really important because as a psychologist, if I have a client that's moving to another province, I'm not able to see them because when you become registered, you're registered within your province. And you can register in other provinces, but you have to actually do that. I can't see somebody who's moved to Vancouver. In fact, I can't even see somebody if they've gone to Vancouver for a holiday.
Oh.
So I'm, I could only see clients in Ontario. And so the beauty of being a cross Canada directory is that I can then go on my own directory and find somebody in Vancouver or Newfoundland or in New Brunswick, and I can make that referral. And the beauty of being mostly digital, because COVID, there were many really awful things that happened to a lot of people during COVID. But I think that one of the good things that happened and why the time is so right for both myself and Jordan in terms of introducing these digital platforms is because my practice, became entirely virtual during COVID and was probably busier than ever before because, as we all know, people's mental health children were struggling at not being at school socially. Parents were struggling having their children at home. Couples were struggling because they were disagreeing about whether you should have the vaccine or not. I mean, so many marital and family issues emerged. And I found that, like we are so up close right now to one another, I actually found that it was even more intimate when I was working with clients online because we were like face to face. And so even though I've opened up my practice to have people come in person now, really only 20% of my clients come in person. And so ReferToMe enables us, as I said, to look Canada-wide, but also I can refer to somebody in another part of Ontario, even if my client lives close to me, where I am residing, because clients can go anywhere. So it's opened it up in that way because we're digital. And what's also really great about ReferToMe is it's free. So people can go on, the clinicians pay a small fee to have their profiles on there, but doctors have completely free access to it, and the public has completely free access to it. So you can just go on and put your information and come up with people right away. And we're growing all the time. So if you don't find what you're looking for one day, you may find what you're looking for the next week.
So can you give us an example, again, of some of the resources that are available? So if I, want to tick off a few boxes, let's say, for my mental health or physical health and well-being, what options would be there?
So we have drop down menu for each search field. So you may put in, if you don't care whether you see a psychologist, social worker, or psychotherapist, for example, you may not fill in the designation field. But if you have coverage for psychology, for example, you may choose a psychologist from the drop-down menu under designation. We have a very comprehensive list of all the mental health and other related concerns that are out there. So for speech and language pathology, we have like stuttering and other like aphasia. For mental health, we have eating disorders, addiction, and then we break it down by the kinds of addiction. I mean, every time we hear of another concern, we add it to the list. We have languages spoken, so you can choose somebody who speaks your mother tongue. We have the province. We have even the fee if you want to choose within a certain fee structure. So what I usually say to people, if you fill out all those search fields and nothing comes up, it's probably because you're kind of reducing your chances of finding somebody because you're putting in too much criteria. So instead, you may take out like the fee, for example, and just put in psychologist Ontario, and then see what comes up. Or you may be more specific, psychologist, eating disorder, Ontario. And usually you'll come up with something like that. So, does that give you enough information?
Yeah, no, that sounds really great. And I was also thinking, and I'm not sure, so I'm going to just ask the question. I mean, does that include any sort of like nutritional therapist? Is there like acupuncture or chiropractors, body work?
Yeah, we have chiropractors, acupuncturists, massage therapists, anybody that works together or collaboratively. Like I would refer to massage therapists, I would refer to acupuncture, I would refer to chiropractic, I would refer to physio. So and people would just go to, you mentioned Refer to Me, but to be more specific, ReferToMe.ca.
Yeah, excellent. So check it out, everyone. ReferToMe.ca. A lot of incredible resources right there at your fingertips so that you don't have to do all the searching. I mean, this is amazing because you can really find, and it's kind of like tailoring it, right? Exactly to your needs and
Right.
knowing in proximity or doing it, digitally. I mean, the access is there for you. So we're going to continue the conversation here on Saga 960 with my special guest helping us to focus on our mental health and our well-being. Dr. Jordan Vollrath and Sara Dimerman coming up after the break. Stay tuned. Welcome back to the Mindset Mentor. I'm Tania Kolar, helping you live your best life. And I know it's really tough to feel like you're living your best life or even to imagine living your best life when your mental health is suffering or, at a decline. We've all been there to some degree or another. And I think it's so important to reach out and get the help, particularly before things really start to escalate because, I think we all know somebody or have felt that our mental health is really, declining dramatically. So it's so important to have our experts today helping us with our mental health and, offering the tools and resources of how to get the help that we need. We have Sara Dimerman, who's a psychologist and author. She's been in the industry for over 30 years. She's written 5 self-help books, and she has created a system called Refer to Me. You can check it out at ReferToMe.ca, which is an incredible resource, tools to find the referrals to the right people, the experts that can help you with your mental health and well-being overall. And Dr. Jordan Vollrath, who's a family physician, and he is also a digital health entrepreneur, and with Cherry Health, which is Canada's medical network, and he's also the chief medical officer there. So I'd love to just continue the conversation with you both. Jordan, as far as, physicians go, I mean, you talked a little bit about how clearly physicians also are experiencing mental health. And I can imagine that, it might be overwhelming when you've got all of these patients, trying to get access to you or needing access and that you want to help, but it can be overwhelming. So how do you refer other people and how do you find the people to refer your patients or clients to?
Yeah, well, you can't boil the ocean, right? So you need that team-based comprehensive care and that support network for your patients, right? And so being able to connect them to those resources in the community is immensely important, right? You can't do it all yourself. You're not trained to do it all yourself. You don't have the time to do it all yourself. And so that's where it is difficult right now. Like healthcare in Canada is very fragmented and scattered, right? And so Sarah's network, Refer to Me, is really, really helpful, especially like as a locum physician, if you're providing temporary relief coverage, you land in a new community, maybe even a new province, you have no network. You don't know what those community resources look like. And so you really are at the mercy of just using Google Maps at that point to try and find something for your patients, which is obviously not as useful as having like a purpose-built dedicated tool to actually give you that detailed information you need, right? Because not all healthcare practitioners are created equal, right? Everyone has their own specific interests, their own specific niche work, their own skills, their strengths. And so being able to plug somebody in, if it's psychology, whatever that very specific thing is, somebody who's well versed in that and can provide that exact type of care. And so that really is the value of the network.
Yeah, and I think that's really key too. But also it's really great to know that if there is a fee involved, and sometimes insurance will pay for these resources, and I think that's important for people to check and look into. I recently found out about oxygen hyperbaric chambers that they're actually some of their services are covered under insurance, and I had no idea. So I thought, wow, wouldn't that be cool if we were to go to, let's say, ReferToMe.ca and check out some of the services and know that is this going to be covered, or also it's important to know if it's not covered so we can budget for that or make a decision. Well, maybe that's not the best thing to do at this time, or maybe it is, but it's really important to have those resources and the access. So we don't have too much time left, so I'd love to get some final advice from each of you. So we'll start with Sara. If somebody right now again is finding it challenging to live day-to-day lives. What is your advice on, where do they start? So if I were to go to ReferToMe.ca, what do I want to type in?
Well, as you said, if it's just if you don't have a specific, if you're not being diagnosed, as having depression or anxiety, you may not need that official diagnosis because you may just know that you have anxiety. You don't need an official label to
Mm-hmm.
say that I'm anxious or I'm feeling depressed. And sometimes you need to find somebody to create that to help you with that diagnosis. Sometimes, if you're a student, you can get accommodations if you have certain diagnoses, etc. So I think just typing in whatever you feel, and there's more general concerns like just stressors or stress could be one of the concerns.
Mm-hmm.
So I think looking for help, and to your point about cost, I know that that's huge. I would say the majority of my clients have insurance coverage, and you wouldn't be able to see online whether the professional is covered or not on my
Mm-hmm.
site anyway. But I think if you have any insurance coverage through your place of work, or you've taken out insurance privately through a company like Blue Cross, then you would be able to contact your insurance provider to find out what they cover. Or sometimes they only cover psychologists or social work. But I know that the colleges of psychotherapy, for example, are really exploring getting their health professionals covered too. And I hope that over time and with their hard work, that more and more health professionals will be covered, because I think it's very helpful. And I would say the majority of my clients are covered. But also look in your community. Like, I actually work for a community agency part-time, where they provide me with people who wouldn't have any coverage through work and who are low income, and they get money from the government to pay part of my fee. I don't charge as much,
Mm-hmm.
but a certain fee in order for me to see these people 5 times. So 5 times is better than no times. And then if they still need more counseling, I may either be able to continue with them, or I may be able to refer them back into the community. Sometimes it's very hard. And that's part of my goal, is to get more community agencies on my site so that it's not all paying for, so people can find not-for-profit or no-paying agencies that they can go to.
Oh, I love that. I think that absolutely makes sense, and I agree that it's certainly needed, and we've all seen that and witnessed that in our lives. And the stress levels and anxiety is shot way up. And it's really important to have those resources. And Jordan, any final thoughts that you'd love to share with everyone?
I'll double down on that. Like, absolutely. If you have benefits available to you through your employer, make use of those. Those are an incredible resource, right? Like, you don't have to wait until something's painful or you're having panic attacks and meltdowns, right? Like, just like your car, you take it in for some routine maintenance and oil changes. You don't have to wait for something to break, and make sure you're being proactive with your health. I think
Yeah.
that's hugely, hugely important. And then, shameless plug for myself and Cherry Healthcare. Like, the next time your physician's talking about not having access to time off, or your community is short on physicians, send them over our way. Cherry.health is the website. We're helping dozens of communities recruit physicians every week, and it's free. There's absolutely no cost. So you too can help your doctor help themselves.
Oh, I love that. It's so interesting because, you think that the medical professionals have all the answers and that their life is perfect, but everybody has experienced stress, and I think it's so overwhelming for any medical professionals in this day and age to really feel as though they're tapped out. I mean, they are stretched to the max, right? So really important to have that access. And all right, so unfortunately, we are out of time. I want to say thank you so much, Sara Dimerman, Dr. Jordan Vollrath, for joining us today here on the Mindset Mentor and helping us to cultivate and live our best lives.
Thank
Thank
you.
you.
All right, stay tuned, everyone. We got more coming up here on Saga 960, and make sure you tune in Thursdays at 3 p.m. for more of the Mindset Mentor. If you'd like to watch a video of today's show, have a look at my YouTube channel and join us on the conversations. Stay tuned.